You're listening to a Raconteur Studios podcast.
Hello, I'm consultant dermatologist Dr. Emma Craythorne.
And I'm consultant dermatologist Dr. Ellie Rashid, and this is the After Our Skin Clinic.
The place where the skin conversation never stops. Now, this is the first episode in a series of 10, and we're going to share with you our golden rules of dermatology.
Over the next 10 episodes, we'll be talking you through the must-know dermatologist tips, tricks and techniques for how to actually identify your skin type, all the way from key ingredients that everyone needs to include in their routines to how to best look after your skin.
As well as the correct way to layer skincare products and common mistakes to avoid. Think of these next 10 episodes as a weekly masterclass that will level up your skincare knowledge.
And as two experts who live and breathe skincare science, we definitely know what we're talking about.
We could even go as far to say listening to our podcast is one of the best things you could do for your skin. So well done, achieved one thing already.
Grab your notepad and get ready to take some notes.
Okay, let's get started. Golden rule number 1, know your own skin type.
I always get asked this by patients. They're like, well, what's my skin type? And I always respond to say, your skin type is really a marker of how your skin functions and how your skin cells function and how much oil is being produced, how much melanin is being produced. So you need to have an understanding of your skin's behaviour and your skin's function.
Well, let's start off with why it's important to get your skin type right. It can often be quite confusing because a lot of the idea behind a skin type is actually based on what cosmetic marketing terms are rather than actually what your skin is like and how it's behaving. So a bit like you said, it's how your skin behaves. Whereas these very generic terms of things like, oh, your skin is dehydrated or oily, or, well, there's lots of different bits going on in different parts of your skin anyway. So I think it's really much more about understanding how your skin functions and behaves. And the reason why that's important is then you're able to almost get the best out of your skin. If you understand how it's functioning and behaving, then by using the right kind of cleanser, by using the right kind of moisturizer, by using the right kind of SPF, then you're going to get the best out of your skin. Whereas if you're not really paying any attention to your skin type and you decide to use a cleanser that might be a bit more disruptive to the skin barrier, well, then you're going to get the worst out of your skin type. And actually, sometimes I see in people who had otherwise really good normal skin, not understanding their skin type and using the wrong skincare products actually end up with a skin disease as a consequence of using the wrong products. So I think it's really important to understand what your skin type is like and understand that it's not the same as the person making the YouTube video and it's not the same as your sister or your best friend. It's unique to you. I also think it's quite important to think that just because you're a certain age, it doesn't mean that your skin is behaving in that way. You know, not everybody who is a teenager with spots has acne. And just because you're at a certain hormonal stage, for example, menopause, it doesn't mean that a cream that's labelled with the word menopause on it is necessarily going to be suitable for your skin. It is much more nuanced than that. It comes right back to the basics and function of how your particular skin behaves. So should we get into a little bit about trying to break this down and understanding these different functions and help people figure out what kind of skin type they might have?
So when I approach a patient and they say that they've got combination skin, I always ask them, what do you mean by that? So what is it about your skin and the way that it behaves that makes you think that you have combination skin? Because I think if you ask most people, they would say, I probably have combination skin. And you need to be asking the right questions to understand how your skin's behaving to then be able to understand what someone's skin type is. And the other thing that people need to just be aware of is to really listen to their skin. So if your skin behaves in a certain way in the summer months, it might behave in a different way in the winter months, or on holiday, it might behave in a different way, or on a plane. You just know what your triggers are, you know how your skin is functioning, how it's behaving, and what you can do to get the very most out of it.
One of the things is understanding how sensitive your skin might be.
You're going to do the onion, aren't you?
I'm going to do the onion. What's the onion? I'm going to do the clearer skin size test. That's how I think about everybody's skin.
You know, whenever we come with conceptualizing things, you always do the layers. The onion layers.
Do
the
I do?
onion layers.
Am I an onion layer girl?
Yeah.
Okay. So big picture.
Yeah.
So one of the most important things I think is about how sensitive someone's skin might be, because sensitive skin is often related to skin that's quite reactive, and you're genetically programmed to react to more things. It might make the skin a bit redder. It might make the skin feel a bit tingly or a bit burnier. But also sensitivity can be related to how well the skin barrier is functioning. It can be a combination of both of these things. So I think it's worthwhile whenever I'm seeing patients in clinic, seeing how reactive that skin is, but also asking those questions that will help me discern whether they are somebody who has sensitive skin or not. And I think of the questions that actually go through the Clearer questioning program, because they can be really quite helpful in helping you work out how sensitive your skin might be. So what do you think is the best discerning question to elicit sensitivity in someone?
My top question to ask if I want to see how sensitive someone's skin is I ask, if you were to go on holiday and stay in a hotel, are you able to just use the products that are available in your hotel room? And if they're like, oh God, no, I only need certain products because I react to stuff, then you just know that they are someone that has a sensitive skin type.
I think that is such a good question to ask, because you immediately work out what someone's skin barrier is like. If somebody then says to me, oh yeah, I can just use the soap that's there, I think, wow, I mean, this person has the most resilient skin.
Yeah.
I can chuck anything at this person's skin because they can use the soap in a hotel room. I think that's a good question. I also like the question as well of trying to work out how often someone might flush, or how tingly their skin might feel whenever they're putting on different skincare products.
Yeah, I often will ask, do you ever put on sunscreen, and will it sting if you're putting sunscreen on? That's another good question. Do you get stinging?
Another aspect of the skin is the amount of oil that the skin is producing. And when we look at studies and ask somebody, oh, have you got oily skin or not oily skin? Often they answer quite incorrectly. And when they measure the amount of oil that comes off people's skin, often that doesn't correlate with what their perception is of having oily skin. And so there's, again, other ways that you can frame that question without actually saying, do you have oily skin? Because often people get that wrong. And I think by looking at somebody's skin, it also gives you a good indication. So my kind of top thing of looking at someone's skin is looking at the pore size. So where I see quite a lot of pores that are bigger, I suppose, in a pinhead, they're clues for me that this person probably has oilier skin. And I ask them questions like, what does your skin feel like 15 minutes after you wash it, and don't put anything on it? So if somebody's skin feels pretty okay after they've just washed their face without reapplying anything, then they're probably more in that oilier skin group.
Whenever someone says they've got oily skin, I always say, yeah, we probably look younger for longer.
Yeah, well, it's true.
Do you know, I did a skin consultation thing with a brand recently, and we did these little short 10-minute skin consultations. Anyway, so many young people, one of their key concerns was pore size. It just kept coming up, 20-year-olds, 25-year-olds, just all worried about their pore size. And the other thing that kept coming up was dark circles.
But you know why the pore size is? It's simply because of all of the kind of filters and images that you see. People don't have pores. So on social media, a pore does not exist.
Yeah, poreless.
Poreless. They're just not there.
I'd be so worried about someone that had poreless skin.
I mean, you'd be like in trouble if you had poreless skin. I mean, you would just overheat.
And the other thing was their dark circles under their eyes, but there weren't dark circles to see. And it's exactly that, because the filters have the under eye dark circle corrector, the even skin filter, all of that. I think people just have this warped image of what good, healthy skin looks like.
And there are pores. But if the pores are a bit bigger, then often that's related to oiliness.
And they can get clogged up with stuff as well. If you have got oily skin, you have got cloggy pores and the appearance of congestion with that sort of blackhead appearance, then you probably do want to use an exfoliating ingredient to try and help soften and clear some of that debris that's collecting in the pores.
So we've got our level of oiliness, we've got our reactivity or sensitivity. One of the other things that some people want to understand a bit better is how reactive their skin is in terms of pigmentation. So if you have an injury to your skin, for example, like an acne spot, does that spot turn red or does it turn brown? And how long does it stay red or brown for? And in the same way that some people might have conditions called melasma, where their pigment cells are a little bit more sensitive to ultraviolet radiation, they're more likely to lay down these brown marks within their skin. And often that's very genetically related. So I think that's really an important factor of understanding your skin, is this tendency to pigmentation.
People with certain skin types that have melanin-rich skin are slightly more prone to getting that post-inflammatory sort of pigmentation that lingers around for longer. I for sure get it. It just lasts for ages after a spot.
And then I think the last thing, whenever we're thinking about understanding your skin type, it's all to do with how your collagen is made and how much collagen you're making and how well you're protecting your collagen. And often that's really reflected in the appearance of the skin in terms of things like lines and wrinkles. And I always quite like to ask people, if you look at your mum and dad or your granny and granda, do they look younger than their age? That's often a very good, really basic genetic test to say, okay, how well does this person's skin age, or how likely is it to age? And then, of course, I ask all the questions about the sun, because the sun is the thing that is a collagen killer. It is the biggest collagen killer. So
just protect yourself from that. Step one. Our children won't be able to be asked that question because have Botox and filler.
Whenever I'm thinking about what a skin type is, it's much more nuanced than just saying you've got oily skin or dry skin. It's thinking about these different components of, yes, the oiliness and dry is one element, but you've also got the resilience of that skin barrier. You've got the tendency to pigmentation from the melanocytes, and then you've got how you're making and preserving your collagen. I think those are the kind of 4 quadrants that I think of whenever I'm thinking of a skin type for someone. And to make that easy, and obviously because I have Clara, which is my own company, which looks at skin types, we have used this philosophy that I've just described and made it a bit more simple and brought it down to being a skin size. So you would be one of 12 different skin sizes, which take into account those 4 pillars that I just described, but it just makes it a little bit easier then when it comes to deciding on what products that you might need or what ingredients are going to be better for your skin. And you can take that exact skin size consultation online at clara.skin, and it's completely free. It helps you think about your skin in those 4 different pillars, and actually then helps you to make much better choices whenever it comes to your skincare.
What I love about the skin size questions is it actually gets people to think about their skin's behaviour for the first time ever. Because no one's ever really asked those questions before. I did it with someone recently. They were going through their skin size questions and they're like, this is brilliant. I've never had to think about this ever before in my life.
Yeah, because you're always asked, okay, what kind of skin do you have? You've got oily skin, and you're like, oh gosh, I don't know. Whereas at least with those skin size questions, it's not asking you questions that you have to be educated to know the answer to. It's asking you about your experience and what happens to you.
I had a patient and she asked me at the very beginning of the consultation, what's my skin type? And I said, oh, well, I'm just going to ask some questions, examine you, and then I'll let you know. Anyway, asked her some questions, examined her, and then went on to talk about those 4 sorts of pillars. And then in the end of all of that, she went, so my combination.
Everyone's combination.
I was like, I'm literally just giving you a 5-minute spiel trying to explain this concept, but the marketing always wins.
Everyone's combination. It's a combination of a lot of different factors.
Yeah, exactly. A common misconception is that if you have acne, then you automatically would have oily skin and therefore you should not be wearing a moisturiser, putting a moisturiser on. But actually, some people with acne can have dry skin, and it's always important to maintain your skin barrier. So I always recommend people do apply moisturiser, but to apply moisturiser that doesn't clog things up and doesn't cause congestion. So often something that's non-comedogenic, often something that's not fragranced, like a light moisturiser that they like the application of is usually the best moisturiser to use in acne.
And I also think as well that a lot of the treatments that we give somebody to treat acne dries the skin out more. And there is this tendency to think, okay, I have acne, so I'm going to buy this cleanser for acne, this moisturizer for acne. I'm also going to be using those harsh products that my dermatologist has given me for acne. And then it's just complete overkill, isn't it? You actually want to use the prescription medicines that you've been given, but typically then have a gorgeous kind of moisturizing envelope around that as well.
You're very into the glowy, dewy look, aren't you? See, I'm still a little bit, I quite like a matte finish.
Well, I do see the benefits of a matte finish, especially on camera.
Someone grab the powder.
The cameraman in the Bad Skin Clinic constantly tells me it's all about dewy lips and matte skin, Emma. I said, I have worked so hard to get my skin so dewy.
Yeah. It does always look gorgeously glowing. Beautiful.
And just shiny under the lights.
Gorgeous. Gorgeous.
Okay, to kind of wrap this episode up, shall we think about certain ingredients or products that might be helpful if you are the extremes of these skin types that we were just talking about? So say, for example, somebody who does have a very sensitive skin barrier, very dry skin, they are not particularly hyperpigmented and they're making a good amount of collagen. So somebody who's got that abnormal skin barrier and dry.
Yeah, so for that sort of skin type, I'd normally recommend La Roche-Posay Toleriane products. They're lovely. And the Toleriane comes as a fluid. So if you want like a lighter preparation, it comes as a cream as well. And then the creamy cleanser, Toleriane cleanser, or Aven do lovely products. So theirs is the Tolerance range. And they've got a nice cleanser, creamy cleanser, and they've also got a moisturizer. So generally that sort of product I would recommend. Unfragrance, good for sensitive skin. What about you?
I would recommend the Day Script from Clear Up.
Our podcast episodes are going to get shorter and shorter.
The reason why I am saying that is because for a morning part of the routine, you've then got that lovely barrier protection. You've got those additional ceramides and free fatty acids and cholesterol, all of those things for disrupted skin barrier. And then you're protecting it still because you've got encapsulated SPF. And because it's encapsulated SPF, it's not going to irritate the skin barrier in quite the same way. It's not going to tingle as much. And then the dry element of it will be helped by those additional antioxidants, but also the really nice moisturizers and humectants, the polyglutamic acid that's within the Day Script. So that actually would be my number one. But obviously I am biased. But even if I wasn't biased, I would still pick it. Can I say that?
Yeah.
I'm biased, but I'd still pick it. And we did do an episode on encapsulated SPFs and how they can be particularly helpful for people who otherwise might struggle with an SPF. So that's really worth checking out.
So what would we recommend for someone that is prone to pigmentation, but also has an oily skin type? So they might be developing spots and sort of has an acne picture. I would normally recommend azelaic acid as a great ingredient. Tretinoin is a great ingredient. But if you want non-prescription ingredients, then there's two product ranges that I recommend. One is by Eucerin, and that's their product range for pigmentation, which contains a patented ingredient called thiamidol. And then the other product I recommend is the La Roche-Posay, which is the Melasyl B3 range. So both of those have got ingredients that can protect from pigmentation, but they also have a lovely non-comedogenic finish, so it absorbs nicely into the skin. So I think it won't make your oily skin any worse, and it might just stabilize your oil producing cells.
And you can use those thiamidols alongside the medical grade treatments. If the person was in the category where they were requiring prescription medicines from their doctor, you can use those ones in addition as well.
Yeah, exactly. So that would be sort of your supporting skincare routine alongside those prescription, which are for sure needed. If you have that type of skin, you do need a prescription of active ingredients that are going to really make a difference. But just alongside it, have your cleanser, your night cream, your day cream, just as a supportive element that has some benefit as well.
We're probably not going to go through every single one of these skin types or skin sizes, but you can actually see it on the clearer.skin website. But another example would be somebody who has skin that's very prone to flushing, redness, maybe a few blood vessels on the surface of the skin, maybe a few spots appearing across the cheeks, and the skin is very sensitive to lots of other kind of topical agents that might be used. What would that kind of routine look like?
So they'll need prescription ingredients. So the 3 ingredients that I usually recommend and prescribe are ivermectin. So the brand is called Soolantra. So this is an anti-mite ingredient, so anti-demodex mite, which has some evidence for contributing towards inflammation and the spots that people get with rosacea. The second ingredient would be azelaic acid. That's a great ingredient for a whole myriad of skincare concerns, but it can be helpful in people that have pigmentation, people that have redness, sensitivity, and acne even. And then the third ingredient would be tretinoin. And tretinoin, again, a real powerhouse ingredient for fine lines, wrinkles, pigmentation, propensity, redness, inflammation, skin cell turnover, exfoliation.
It's like the holy grail.
It really is. But yeah, more prescription if you have that sort of rosacea prone, redness, sensitivity skin type.
And it's those 3 ingredients that you have just said are the 3 ingredients that we have as part of the Clearer Special for people who have rosacea. The wonderful thing about that is it's all wrapped up in one serum that's applied at night time. And then in addition to that, you have to be very careful with the kind of cleansers that you're using. For somebody who's in that situation, you can't be using harsher cleansers. You can't really be using foaming cleansers, avoiding things like fragrances, and using SPFs on the skin that are going to be, encapsulated SPF is a great idea to reduce that kind of sensitivity. This is all about keeping the skin cushioned and protected to try and reduce those flares of redness that occur. Okay, that brings us to the end of our first golden rule: know your skin type.
We really hope this episode has cleared up any confusion and given you the tools to help you understand what your skin might need.
Over the next 9 episodes, we'll be diving into more of our golden rules, from the ingredients you shouldn't skip to the mistakes we want you to avoid.
Think of it as your weekly dermatologist-approved masterclass in expert skincare.
And if you've enjoyed today's episode, please do follow us or subscribe to the podcast. It really helps us keep the After Hours Skin Clinic going, and it means more skin enthusiasts like you can join the conversation.
You can also find us on Instagram or via email. We absolutely adore hearing from you, and all the details, as always, are in the show notes.
So that's bye for now. Take care of yourself, take care of your skin, and don't forget your SPF.
And see you next time on the After Hours Skin Clinic.
As always, this podcast is for informational purposes only and is not a substitute for medical advice. Please consult your healthcare professional before making a change to your treatment.